A workplace health and well-being strategy is an essential framework for creating a supportive environment that promotes both the physical and mental health of employees. Organizations that take a proactive approach to well-being not only fulfill their duty of care, but also benefit from increased productivity, reduced absenteeism, and higher levels of engagement. Developing such a strategy requires a structured approach that aligns with organizational values, meets employee needs, and is embedded into daily operations rather than existing as an isolated initiative. The first step is to establish a clear vision and objectives for the strategy. Senior leadership must recognize the importance of well-being and commit to its integration within the organization's culture. This commitment should be reflected in written policies, resourcing decisions, and leadership behaviors. Objectives might include reducing stress-related absence, improving job satisfaction, or increasing participation in health-focused activities. These goals should be measurable and linked to broader business outcomes to ensure accountability and progress tracking. A successful well-being strategy must be based on evidence. This involves gathering data from a range of sources such as employee surveys, absence records, occupational health reports, and exit interviews. Direct consultation with employees through focus groups or interviews is particularly valuable, as it provides insight into the specific challenges and priorities within the workforce. It is important to recognize that well-being is not solely about physical health. Mental health, work-life balance, job design, and organizational culture all play a crucial role. Once the key needs are identified, the strategy should outline targeted initiatives to address them. These might include flexible working arrangements, mental health awareness training, access to counseling services, ergonomic assessments, or healthy lifestyle programs. Where possible, initiatives should be inclusive and adaptable to different roles, working patterns, and individual circumstances. Employee involvement in the design of initiatives helps to ensure relevance and encourages participation. Communication is a central element of implementation. A well-being strategy should be clearly communicated to all employees through multiple channels, such as staff meetings, newsletters, intranet updates, and posters. Managers should be trained to recognize signs of poor well-being and to signpost appropriate support. The organization's commitment to well-being should also be visible in its everyday practices, such as workload management, recognition schemes, and opportunities for personal development. Evaluation is essential for sustaining a well-being strategy. Organizations should regularly review the effectiveness of initiatives using both qualitative and quantitative measures. Employee feedback, uptake rates, and changes in absence levels or staff turnover can all provide useful indicators. Adjustments should be made where necessary, and successes should be celebrated to maintain momentum and reinforce the value of well-being initiatives. Ultimately, developing a workplace health and well-being strategy is not about implementing isolated benefits or one-off events. It is about embedding a culture that values and supports employees, recognizing that healthy, motivated staff are central to organizational success. By taking a structured, evidence-based, and inclusive approach, organizations can create a workplace where well-being is an integral part of everyday working life.